Today we will learn how to use a micropipetter. Before we begin, we must first go over some general safety rules about working in the lab. When students are working in the lab, they should avoid wearing baggy clothes. It is also important to wear long pants in the lab. Also, students with long hair need to make sure that their hair is pulled up at all times. In addition to this, it is important to wear shoes that cover the foot entirely. Now that we are appropriately dressed, we can proceed with the exercise. A micropipetter is an instrument used to measure small volumes of liquids. In the first exercise, we will learn how to use the micropipetter. Micropipetters come in several different volume ranges. In this exercise, we will use a 2 to 20 microliter pipetter, called a P20, and a 20 to 200 microliter pipetter, called a P200. To adjust the volume of a solution pipetted, turn the dial at the top of the micropipetter. Never turn the dial outside the range of the micropipetter. The range can be found on the top of the colored plunger. There are two stops on a micropipetter. When pipetting liquid up, push the colored plunger at the top of the micropipetter until you feel the first stop. The yellow tips are used for these micropipetters. Make sure to use a new tip between solutions or after pipetting into a different solution. When placing a tip on the micropipetter, do not touch the tip with your hands. Make sure that the tip is pushed tightly on. When practicing aseptic technique, it is very important to close the lid on the tip box, so try to get into the habit of doing this early. To aspirate a liquid, hold it at the first stop. Do not go past the first stop, and place about 1 centimeter of the tip into the solution and slowly release the hold on the plunger. To release the collected solution into the appropriate container, push the plunger slowly past the first stop until the second stop. To discard the tip, press the button on the side of the micropipetter next to the colored plunger. Now we need to create a sterile work environment to minimize contamination. First, spray the bench top with 70% ethanol and wipe it down with a paper towel. Now, connect the Bunsen burner to the valve and turn the gas on approximately halfway. Use the striker to light the flame. This will create your sterile working bubble, and you will need to remain within 1.5 feet of the flame for the duration of the exercise. To get out microcentrifuge tubes, hold the beaker and remove the aluminum foil lid. Pass the lid and the lip of the beaker through the flame. Gently shake out the tubes. Run the foil and the lip of the beaker back through the flame before you close it. Quickly close the tubes and place them in the rack. Open and sterilize the bottle of water. Keep the lid on the bottle when you are not pipetting liquid out. Now, set the P200 micropipetter to 200 microliters and put a tip on it. Pipette 200 microliters of water into a microcentrifuge tube. Now, sterilize and close the bottle of water. Now, set the P20 micropipetter to 10 microliters and pipette 10 microliters from the first tube to the second until you feel comfortable with this technique. You must always have a tip on the micropipetter before inserting it into any liquid, or the micropipetter will be ruined. Always keep the micropipetter in your hand when there is a tip on it. Do not lay it down on the bench. Always hold the micropipetter vertically when the solution is in the tip. If the micropipetter is held horizontally or inverted, the liquid will go into the micropipetter and ruin it. If the micropipetter tip touches anything but the liquid or the sterile container, get a new tip. Dispense the liquid slowly so that it does not splash out of the tube or back into the micropipetter. Always place the lid back onto the jar without setting it on the bench top. Also, avoid sneezing or coughing in the area you're working because it can cause contamination.